An electrocardiogram, or ECG, is a simple test that records the heart's electrical activity. It's a painless and non-invasive procedure. The ECG helps doctors understand how your heart is beating. It shows the heart's rhythm and any abnormalities in the heart's electrical system. The ECG works by detecting tiny electrical signals produced by the heart with each beat. These signals are then amplified and recorded on graph paper or a monitor. The resulting pattern is what we call an electrocardiogram. The ECG is a powerful tool in cardiology. It helps diagnose a wide range of heart conditions. These conditions include arrhythmias, heart attacks, and heart blocks. Understanding the basics of ECG can empower individuals to take an active role in their heart health. It also helps patients understand their diagnosis and treatment options better. The heart is a muscular organ divided into 4 chambers, 2 atria and 2 ventricles. The electrical system coordinates the contraction of these chambers. The signal originates in the sinoatrial node, the heart's natural pacemaker. It travels to the atrioventricular node, then down the bundle of His. The signal reaches the Purkinje fibers, causing the ventricles to contract. This coordinated contraction creates the heartbeat we feel. The ECG tracing is a visual representation of the heart's electrical activity. It consists of a series of waves and intervals, each corresponding to a specific electrical event in the heart. Understanding these waves and intervals is crucial for interpreting an ECG. The P wave represents the electrical depolarization of the atria, meaning the electrical activation that causes the atria to contract. The QRS complex, a group of 3 waves, represents the depolarization of the ventricles, leading to their contraction. The T wave follows the QRS complex and represents the repolarization of the ventricles, meaning the electrical recovery of the ventricles as they prepare for the next heartbeat. The intervals between these waves also provide valuable information about the heart's electrical activity. The PR interval measures the time it takes for the electrical impulse to travel from the SA node through the atria to the ventricles. The QT interval reflects the total time it takes for the ventricles to depolarize and repolarize. The ST segment represents the period when the ventricles are fully depolarized. By analyzing the duration, amplitude, and morphology of these waves and intervals, doctors can identify irregularities in heart rhythm, conduction abnormalities, and signs of heart damage. The ECG is a valuable tool for diagnosing a wide range of heart conditions. Abnormalities in the ECG pattern can indicate problems with the heart's rhythm, damage to the heart muscle, or issues with the heart's electrical conduction system. For instance, atrial fibrillation, a common type of irregular heartbeat, typically shows up on an ECG as rapid and irregular electrical activity in the atria, resulting in an absent P wave and an irregular ventricular rhythm. A heart attack, on the other hand, often causes characteristic changes in the ST segment of the ECG, indicating a lack of blood flow to a portion of the heart muscle. ECG leads are like different angles of a camera, capturing the heart's electrical activity from different perspectives. By analyzing the ECG from these various leads, doctors can pinpoint the location and extent of heart damage, or identify the origin of an abnormal heart rhythm. The ECG is a versatile and essential tool in cardiology. Its ability to provide a real-time window into the heart's electrical activity makes it indispensable for diagnosing and monitoring various heart conditions. Understanding the basics of ECG empowers individuals to take an active role in their heart health and make informed decisions about their care.